Well, it's good to go. Give them a couple minutes to get in.
All right, and where are we at? There we go. All right. Okay. Get everybody time to get in.
Mm-hmm.
All right. Woo. Getting a little hot on here. I'll tell you. It's going down. All right.
That's the one you see a couple of people, Key. I'm looking at you too.
Yeah, it's only I see you. I see you, and I haven't seen nothing else yet. So, see people chiming in on TikTok. Definitely see that.
Let me know when you're ready to go.
I'm ready. I'm ready.
Ready? Good. Okay. Good evening. Good evening. Welcome back. Welcome back. Thanks for joining us. We are Unspoken Truth Podcast, where the conversations are raw, uncut, and filtered.
Hold on, girl. Forgive me, Lord. Forgive me. I was trying to get everything together. Okay. Sorry, my bad. I was trying to get everything together. I'm okay. I got this. Okay.
Welcome, guys. Sorry, this little hiccup. You already know how we get down. So just.
All right, let's go. Cue it one more time. Action.
That's right. Hey, welcome back to Unspoken Truth Podcast, where the conversations are raw, uncut, and unfiltered. I am your girl Boots,
and I'm your girl Kiki. And tonight, ladies, this is one is for you. We're talking about women's health, not just physical, but mental, emotional, spiritual.
And tonight we have here with a special guest on the couch, and Mrs. Darshell Darby, MSS PAC. So guys, please give us a welcome.
Yay!
So before we get started, we're going to allow Ms. Darshell to introduce herself. But if you guys, before we get started, if you are on whatever platform, please don't forget to follow, subscribe, like, comment, share. Tonight is going to be a very critical discussion about us. So if you can chime in, ask a question, we're going to be providing a phone number so you guys can call or text. So before we get into all that, we are going to give Miss Darshell the floor and just tell us a little bit about yourself.
All right. As they said, I am Darshell Darby. I am a physician assistant. If people don't know what PAC means, a certified physician assistant. I also have my master's in medical science, and basically I concentrated in women's health. I did do some family practice as well, but majority of my work has been in women's health for the past 12, 13 years is where I have sat. And so dealt with all things from OB, annual gyne exams, perimenopause, menopause, kind of just walking through life, so to speak, the woman's adult life. That's been my bread and butter.
Okay. Sounds good. And what inspired you to get into women's health?
Let's see. Well, to get into medicine, period, because I used to want to be a lawyer. Okay. I like to argue, I like to talk, so that's the whole thing. My husband was, agree with that or not agree, whatever. Either way it goes. But so I remember a family member was sick, and I remember the doctor was very nice. So you expect nurses to be nice, and you expect that, but the doctor was very, very nice. And I was like, I want to touch people in that way, be able to do that. And I didn't think I could do that as a lawyer. I probably could have, but I didn't think that I could. And so I started down the medicine track, and I was probably about 15 or 16 in high school. And I started down that track. And then I was going to go to school to be a medical doctor because I didn't know about PA. At the time, like Midwest, we're slow. Like the East Coast gets stuff, the West Coast does stuff, and then the Midwest does, South does. So we're kind of slower to those things. And I met a doctor, and she was mentoring me. She was like, "This is really what you want to do?" And I was like, "Yeah." And then she was like, "Have you ever thought about being a PA?" And I was like, "Oh, because I don't even know what that is." And I met somebody who was a PA, and I was like, "Okay, this is kind of cool." Because one, I get the same training as an MD. My training is just shorter, but we do the same thing. So like the same rounds, like when I would do my training in the clinicals, I was standing next to residents and things like that. So I was like, okay, this is kind of cool. I like the PA track because I can switch genres if I wanted. So if I want to do dermatology tomorrow, I could.
Okay.
That kind of, I didn't have to stay specialized in one thing. So that's how just the whole PA thing kind of came about. And so, but women's health was where I wanted to stay. I had three. My always women's health was top, psychiatry was second, and then trauma was third. I felt like I wouldn't have a life with trauma.
Yeah, no, you would not.
But I probably would have more of a life than I do now, because when you work outpatient, it's more. When you work in the hospital, once you're done, and the patient's closed. But then when you work outpatient, it's like, no, the patient is you think about the patient all the time, and notes and stuff like that. So I was like, well, wait, I don't think about it, but I love it though. I wouldn't trade it for the world. And so this is where I said.
Wow.
Absolutely. Absolutely. Thank you.
That is, I love that. That is awesome. And man, God is good. So for you to do that and figure it out, and that's how things work out. And I heard you did a fashion show.
I did. So I'm a part of a bunch of organizations and all these things. And so we do an annual fundraiser and we get a fashion show. And that was this weekend. It was Saturday. Yeah. So I do event planning on the side.
Okay.
Like,
Okay. All right. Okay. All right.
Is it a business, or you just do it in spare time?
Right now, I have worked for myself, but right now I work for somebody else. So it's called Diamonds and Lace.
Okay.
Eventscaping. So I let them do that work and then call me, and then there I go. To kind of do that.
So now we can plug you in and let you know if you're
There
looking
you
for
go.
an event planner.
Right.
Let us know. Let us know.
You well-rounded.
Awesome.
I'm glad you
All right,
explained
Miss Darshell.
I'm glad she explained what a PA is. I knew what a physician assistant, but to the degree and the magnitude, how you work under.
Yeah. Like I said, we're able to write prescriptions and do all those things. Yeah. So a lot of times, some people might even see the doctor. They see us from beginning to end, kind of a deal. The doctors they know, like they have access to the charts and they can see them. And of course, if you need them for something, they're there. My doc would do the surgeries and stuff like that. But yeah.
Okay. And how long is the training? Just for anybody who's considering the medical field, how long is the courses, classes?
So you would need your bachelor's and whatever that looks like. So that's 4 years. And then most schools right now are about 2.5, 3 years. Okay. Maybe 3.5. You'll have maybe like a year and a half of classroom work. And then you go into your clinicals. And so for us, like you go through surgery and then you go through family practice and peds and all those things, just like residents would do. And so you go through all of that. And so it depends. It's so many months. A lot of programs now are set up for you to get your master's. So that's why you need your bachelor's first. And then you can get your master's. And so you work alongside with those and doing those papers and stuff like that comes along with that.
Absolutely. Good stuff. I love it. I love it. Okay. Anything else you want to add? Just your personal intake about the medical field, or what made you come sit on the couch?
Y'all asked me. You asked, so I came. To come sit on the couch. Do
you think it was an important conversation that we should be discussing?
I do. I think the conversation is happening more than it ever has in the past. Like I say in our parents or grandparents' day. I think the conversation is happening more, which is a good thing.
Yeah,
which is a good thing.
Totally agree. Okay. Wow. Okay. Well, I hope everybody out here with their questions, because we need it. And I know I do have a question. I know a woman that was talking to me about her body of, that she was going through. So, but I know that I think Boots, you said you had a couple of questions you want to ask.
No, just before we get started into our dialogue, I want to provide the phone number if people had questions or want to call in or text your questions. So guys, ladies, if you are out there and you have a concern or question for Ms. Darshell, please call 224-404-1845. You can send your message or your question over to the line. We'll air it and we'll add. You don't have to leave your name if it wants to be confidential, but just shoot your questions over. We'll see if Ms. Darshell is able to get an answer for you. I know I have a lot of questions, but I don't want to take up the whole hour.
Right.
So please come on. Let's get it in, ladies, especially us ladies, us Black ladies. Let's get these questions in, and let's see how we can take care of ourselves.
Yes.
Okay.
Most definitely.
Go ahead, Key. You have some questions, or you want to?
Well, I was saying about, I'll say, period. Like
Okay.
when women have their period. Like, is that kind of like premenopause if they haven't had a period, like in say 4 or 5 months, right? And then when they do have a period, it's like a month. It's like she's bleed for a month. What is that premenopause sign or?
It can be.
Okay.
It can be. So we would call that perimenopause. So if you haven't had a period for a while, of course you do all the things, right? You take pregnancy tests, you do all those things, because that's when you're supposed to miss it.
Right.
And then those come back negative. You would come in and then we would do blood work to see kind of where you sit or stand. A couple of things. You could just not be having a period. We'll figure that out why. Some things is your thyroid off. You know, you look at other things. Do you have some fibroids? You have certain things, like what's happening, because we always want to say it's this, but it may not be that. And so then you just want to look at it and do your blood work, do your ultrasounds, do your due diligence to figure out exactly what's happening. And then things will tell us, you know, okay, where we're sitting and where we're staying. Sometimes stress is a thing, and stress can take your period away. So sometimes if you're going through some things, sometimes it's just that. And then we think I'm going through that, but like, nope, your blood work don't say that at all. But then you'll talk and then people are like, oh yeah, unfortunately, like I'm going through divorce. My parents died. You know, certain things like that. That's stressful. You know, and so your body has a response, and it's either one, you can bleed heavy, or two, you cannot bleed at all. So it'll take whatever course it wants to take. And then we go from there. And then if you have it, and you bleed for a long period of time, then we want to make sure, number one, we rule out any cancerous things or precancerous. Like, why are you doing it like this? Could it be because you haven't had a period? Very well could be, but it's still uncomfortable. And it's not where you want to be. And you want that to stop and end. So then you rule out all of the bad. As I always tell people, I'm going to rule out everything that's bad. And then we can work with what's happening. You can see if it continues. So then if it continues, and if it was a fluke of this one-time thing, okay, we'll go with it. We've done all our work. But if it continues, then we start looking at, okay, what can we do to make this more regular? Then it depends on where you are in your life. Do you still want to have children? Are you still like, what are we doing? Are you okay if it goes away? Then okay, we're okay if it goes away. So it also just depends on where you are in your lifestyle to determine which way we go with it and what we do. Is it fibroids? Is it, you know, those kind of, what do we do? Do you have a polyp in there? What's happening? We remove those or do what we can if it continues to cause, what we call it, disruption to your activities of life.
Okay.
So just to piggyback off of that. So say, for instance, you know, you're not having a menstrual every month. You concerned. You rule out all of those symptoms. Is there a procedure, a process? Do you go through an MRI? Do you go through some type of, you know, process where we can look in and see what may be the issues? You know, we address the external. So now, what next steps will we take?
So our bread and butter for a gynecologist is ultrasounds. Like that's our first go-to. Even if you ever go to the ER or something like that, and they do a CT and they see this, I'm like, nope, I need an ultrasound. This means great, but my bread and butter is an ultrasound. So that would be the first step of taking a look technically on the inside, just to see what we see. Like I said, if you're bleeding a lot, then the biopsies come into play and those kind of deals. Sometimes you might hear women who have a hysteroscopy or something like that, where we take a scope and put it inside the uterus, and then we fill it with water so we can look inside and say what's actually happening in real time. Like, what does it look like in here? I always say, does it look fluffy? Which means it's just a lot of lining in there. Does it look okay? Does it look atrophic, meaning you are going into those menopausal stages, and so it's just not a thick lining? You're like, okay. And then you always test it, but then we can just get a picture of like what it looks like. Are there polyps in there? It's like, what's happening in there? So those would be the tests that we would do to try to figure that out.
So you got a question, or you?
No, you.
So, and I'm saying this because, you know, at my age, sometimes we don't really recognize the symptoms of premenopause, or if we are in full-blown menopause, right? Is there a test, or do you? I know you speak with your doctor. How do you know if you are in full-blown menopause?
Well, menopause is defined as you don't have a period consecutively for 12 months.
Okay.
Oh,
So
okay,
once
okay.
we hit 12 months
Okay,
consecutively,
Mhm.
Good
that's
stuff.
it. Right?
Wow.
Okay.
That's it. That's all. And that's how it's supposed to be. Now, if you're younger, like we have some, if you're younger or things like that, because again, like our younger women are,
Right.
they can have PCOS, they can have other things that don't have them have a period.
Of
They're
course.
not in menopause. So then that's when you do all those blood work and things like that.
Mhm.
You also do blood work to look at FSH levels, which is your follicular stimulating hormone, because once we are and your estrogen, so once we are menstruating, like your FSH is low, because it's basically telling your ovaries, let's make some eggs, right?
Okay.
And your estrogen is high. That's what's happening. Once we start to get ready to go into menopause, and once we're in menopause, your FSH number starts to get higher and your estrogen starts to come down.
Mm.
So when your FSH number is about 20 or greater, and once it starts hitting about 10 or 15, but 20 or greater is when we really start. Then we're like, okay, here we are. And now we
Mhm.
just wait on the body to do its part.
Okay.
And then the estrogen starts to come down, and people are symptomatic. Some people are not symptomatic. I always tell people, I treat your menopause like I treat your periods.
Mhm.
We're all going to do it.
Right. Right.
Right.
How we do it though could be very different, right?
Right.
You know, those women who they're like, I wear a panty liner for 2 days. You're like, oh, shut up.
Right.
Then you have the other ones who are
Yeah.
just like, yeah, I'm
Yeah.
bleeding through everything I got.
Right,
And I'm
right,
wearing like
right.
50 pads and stuff
Right,
like that. So
right.
we treat what we get. There are some women
Right.
who go through menopause and they don't have anything.
Right.
And
Right.
you're just like,
Okay.
okay, we'll rock with it. And there's some who just may have one symptom. They're like, I'm okay. Okay. Then there's some who has the whole gamut. So I'd say I just treat what you give me.
Okay. And
Sure,
is
yeah.
there like medication? Like, what if someone don't take medication? Is
Mhm.
there anything they can do to help them? Like, if they have hot flashes and those mood swings when you get into that,
Yeah.
that field.
So it depends on what you feel comfortable with. And I
Mhm.
always tell people, like, when you come and see me, I just give you everything that I got in my arsenal, right?
Right.
Because it's where you feel comfortable, because
Right.
it's you that is going through it.
Mhm.
What I may do is different, what you may do is different. Our family histories are different, all of that.
Absolutely.
So I give everybody from, you can do again absolutely nothing.
Mhm.
There are there are hormonal things, but there are also supplements and things you can do. Like
Okay.
people know about Black Cohosh and things like that.
Mhm.
I
You
just
do-
heard of that.
So
that
what's
helps with,
that
like
is?
that, like it just helps with like hot flashes and things
Yes.
like that.
Mhm.
So some people do that and I'm like, it's great. Let's go with it.
Okay.
There are things like over the counter, like Estroven.
Mhm.
And they've like when when it first came out, they only had like one thing. Now they've kind of separated into like
Mhm.
moods, or now if you're just feeling
Mhm.
hot flashes or that kind of a deal.
Mhm.
Then I used to work with a company, a lot of Metagenics. I still do. They're a great company. And they have things for like perimenopause and
Mhm.
menopause. So it's just basically a bunch of supplements.
Mhm.
And they can help. I always tell people it's a 50-50 shot.
Right.
Not because I don't think they're great, but
Mhm.
everybody is different.
Right.
So I can go in 2 separate rooms and I can say, yep, try this.
Mhm.
You may come out and be like, that was the best ever. And I'm like, great, hit it. You may come out and be like, that didn't really work. Okay, let me get back to the drawing board with you.
Right.
And it's not that I don't think it's great, it's just how you responded or how your body responded to it. So then
Absolutely.
we move on. And of course, we have hormonal things we do to help it. Now, your hormones, will you catch it and get it more? Yeah, because if I'm giving you back something that you don't have,
Mhm.
then of course I'm going to help it a little bit more than
Mhm.
the supplement. So,
Right.
Absolutely.
Depends
So
on where
when
you sit.
do the hormones.
Mhm.
It's like, is that shots or medication or?
It depends. So now, like recently, the FDA took the black box warning off of the like patches and things like that, right?
Mhm.
Because before they did that back in the day, right? They were
Mhm.
like, if you had it for too long, then you get cancer. All that.
Mhm.
Found out that that was not the case. So
Mhm.
now a lot of women were suffering because one, they were scared, and rightfully so.
Right.
I'd rather have a
Right.
hot flash than cancer. I would choose
Absolutely.
that same
Any
option
day.
as well.
Exactly.
So I'd
Yes.
like I can
Yes.
cool down. I choose that any day of the week. So
Right.
now that has come off, that helps a lot. So now, there are patches, things that you can get from the pharmacy. Some people would like to try to go more bioidentical. So we would do pellets, which are hormone pellets, where we would place in the body and let the body kind of work the same way it would naturally work.
Okay.
We didn't do shots
Okay.
so much, but I know there are some places that probably do
Mhm.
shots and things like that.
Wow.
That's good stuff. Good
Okay.
stuff.
It's coming a long way.
Okay.
Yes,
Yeah.
man.
Than
now I
Grandma's
know.
day.
So do we have any questions on YouTube? Because I see them chiming in.
Yeah, let's go ahead and take a look at YouTube. So I'm sorry, so we have Mama Grand Rising Clear. Hi, beautiful women. Thanks for chiming in. TW2715 says, how much training do they get in nutrition? Or as PAs, I'm assuming. Do you guys get training in nutrition?
You do, but that's like across the board. Medicine is not.
Okay.
More naturopaths and those kind of deals. They do a lot more in nutrition.
Mhm.
You follow more of a disease state and like what's happening with that disease state. You do get into some nutrition, but I know naturopaths and things like that, they do it a lot more than most medical doctors and things like that do.
Awesome. Good stuff.
So it's kind of you learn on the job kind of deal.
Gotcha.
Yeah. Nikita Field 7213 says the guest seems very knowledgeable, informative, confident, approaches, and masterful of her field.
Yay.
Exemplary. Okay.
You got to start. I got you, Boots. You got
You
got to-
profession.
That-
Y'all, my
no
contact
contacts ain't
is too,
playing
I
with you.
promise you.
You need some blue light glass.
Yeah. Women need more like her in the field, especially the
Amen.
community consisting of Black women and those of lower access to higher health care. Absolutely.
I do
And
agree.
these are one of the reasons we wanted someone that looked like us for us to talk about us and speak about
And
us.
know our body.
And
That's true.
So thank you for that. You want to check TikTok?
TikTok, we just got hearts and people just timing in. So
Okay.
I don't see any questions on TikTok. My Facebook, we just got people chiming in and listening. That's
I don't know what's
basically it.
over there on this one.
That is your Facebook.
I
And
can't see anything on
So,
that.
but it looks like it's just chiming in.
Okay.
Yeah.
All right.
Okay.
All right. So again, guys, if you have any questions, comments, you can either give us a call at 224-404-1845 or text your questions. And we can see if we have an answer for you. Don't be shy. This is your opportunity. Let's address some of these issues.
Now I have definitely a question. Like, okay, women, like, we go through what we go through and our body changes, and they say, like, if you do go to menopause, sex drive, if let's say pre-menopause, sex drive kind of like decreased, wetness kind of decreased, correct? And I was wondering, like, will you be more moody too, right?
You can.
So you can. So everybody's body is different.
Everybody.
Right. So I'm thinking, like, when in the sex part of, like, you want to be more wet.
Just call it what it
Yeah,
is.
be more wet. Be
Call
more
it what it
wet.
is.
So what do you do when you trying to be more wet for your person and your body is changing, but you can't get there? What can we do?
So you can do lubricants.
Okay.
You just gotta be honest with yourself and realize that that's just what's happening, right? It's not your fault. It's just your body. And a lot of times too, if you are experiencing vaginal dryness, then that also messes with your libido, because you could be in your head about it, like, okay, now I used to be all over the place. Now I'm not, like, what is happening to me? Like, this ain't right. So now you're in your head about it. And if you're experiencing vaginal dryness too, you can experience pain. So then you're like, I won't do that because it hurt. So, like, who wants to do that? Like, who's gonna keep touching a stove? If it's hot, it's hot. So I'm not gonna keep doing that to myself.
Right.
And so with that said, you can do, like I said, lubricants. They can help. Some of the hormone replacements will help. So sometimes putting the estrogen back. I always tell people, we've had estrogen our whole life, right? As women, we don't know what it is not to have it until we get here.
Right.
And then basically, what is our natural lubricant? Estrogen. So once that starts to go down, yes, we can lose that part. And so once you replace that a lot of times, you can do that. There are a lot of natural supplements out there too that you can take that helps, because some people are like, I don't want to do the hormone. I get it. I get it 110%. So there are a lot of some medicines that you can use that literally don't have any hormones in it. DHEA helps. A lot of people take that sometimes because that's basically the hormone that's the precursor to estrogen and testosterone. So people take that so they can create more of that kind of naturally. They do those. Hyaluronic acid is good. It sounds like it's not, but it is. And then you can place that inside the vagina, and that can work. But then again, you could just go replace it with good old estrogen. And then that can do that as well. So again, just depending on what you're comfortable with. And like I said, some people start out with, I just want to do a cream and I'm having intercourse because it doesn't bother me any other time. Some people, it bothers them all the time. Like, I feel dry, like I'm just walking, I just don't, then okay, we might need to do something on a more long-term basis. But it also depends on just how extensive it is, and then where you go from there.
Okay.
I seen in Target the other day. I never seen it before. They have libido vitamins.
Mm-hmm.
So I don't know if that's something new, but ladies, if you need it, libido vitamins in Target. So
Yeah, they're out more than ever.
Mhm.
Now, like I said, people are talking about it more. Before they only cared about men's libido.
right,
They didn't really care about ours. So now there are things on the market for us as well. So like I know people have heard hers. You're hearing about them a lot more now with the GLP-1s, but they did a lot of the hers. So they do a lot of the stuff for vaginal dryness and libido and things like that.
Is that a good company, hers?
Hers is a good company. It's a good company. There was another one that was a I think it's Her Fantasy Box. I think it's Her Fantasy Box. Make sure you put that whole word in, because if you put in like Her Fantasy or something like that, something else may come up and that's not what you want. And when I would be at work, I would type it. I was like, they're gonna fire me because they're gonna be like, what are you doing? But I think it's Her Fantasy Box. But they have like a whole I'll look it up on my phone real quick. They have a whole like line of natural stuff for women too, like stuff for libido and things like that that you can do.
Somebody on YouTube says drink some okra water.
I've heard that.
Really?
I've heard that. A patient of mine did that, and she said it worked.
Whoa! See that, ladies? Okra water.
Not eat okra. I can't
eat
it.
okra, but I
can't
okra
drink
That
it.
is okra water, and it's an okra water. It works.
Does it taste slimy?
I haven't tried it.
Maybe you
I
can
haven't
blend it
tried
up. How do you drink okra?
I think they just drink it. Like you put it in the fridge and you just drink it.
Or do you crunch it up like in the blender?
I think it comes already ready. I was like, you don't have now. I guess you could if you want to go buy a bunch of okra. You could, but I do think that some places just sell okra water, and that's not the first time. And there are things like Her Fantasy. It is called Her Fantasy Box. Like some things I hear about from my patients. Like they're like, I tried this and it worked. I'm like, hey, all right, I'll tell somebody else. Work for you, and it can work for that person. It's cool. So like, I had a patient use okra water, and she said it worked.
Okay. Well, thanks for that, Miss Freaky Faith.
Yes.
Yeah.
She said the honey pot urinary tract vitamins work too. Look at this girl.
See.
Somebody asked, what should a female do if dealing with PCOS? Is it
PCOS?
PCOS?
Yeah, I just said that's PCOS. Same thing.
Okay. Endometriosis and fibroids.
Kind of a loaded question. And when I say loaded, meaning I just don't know where they are as far as in their adult women lifestyle. Like, are they trying to have children? Are they trying to like certain things? Because that'll determine kind of what we do. And I say that to say this. So with that being said, if you have fibroids, if they're small, we just kind of monitor them. We don't do too much because this thing, fibroids can grow back. So we're not in the business of, you really don't want to keep messing with the uterus if you don't have to.
Right.
If they're inside the uterus, they're easier to remove, right? We're not just cutting inside the uterus, but if they're in the wall on the outside of the uterus, that's a lot of cutting. And so you don't want to do that if you really don't have to. Now, if you still want to have children and those kind of deals, then we kind of wait like until you're ready. And then we're like, okay, let's go ahead and then go, because we don't know the rate at which they'll grow back or when they'll grow back or those kind of deals. So that's why I say it's kind of loaded sometimes with that. Endometriosis, kind of same thing. Now they do laparoscopic procedures to remove the endometriosis. So they'll go in and they'll do it. That's truly how endometriosis is diagnosed. A lot of times it's a diagnosis of exclusion because we have to see it to really say that's what it is. And the only time you really see it is a lot of times if you had a hysterectomy or you were in there and they're like, oh, yeah, we see the endometriosis. But now some surgeons are doing laparoscopic procedures. Again, the endometriosis can grow back. So it can be extensive. It can be in the bladder wall, the ovaries, those kind of deals. So it depends on it's just like where you are with that. As far as the PCOS is concerned, I would definitely make sure that you keep up on your labs, look at your insulin, look at all those things. Keep your weight under control because that plays a big part with the PCOS. A lot of times people go on hormones for them because that's just what helps to regulate them. Sometimes weight control helps to regulate them. So sometimes if they are overweight or obese, they might not have a period. Sometimes if they get their body in a certain weight, then they will continue to have a period on a monthly basis. And they're happy with that. Some people are fine, just know they have PCOS, and if they don't have no period, they're okay with it.
Mhm.
And you're like, okay. But as long as we know what's happening, but we
Mhm.
would want you to try to have a period at least once or twice a year, because we want you to at least shed that lining
Yeah.
that you get. We just don't want it kind of sitting there. And sometimes people will take pills just to make sure they have a period,
Mhm.
periodically, and then they're fine.
Mhm.
If they want to start having children, then we start to put you on something continuously, so we can get you to just keep having a period, so we can get you to have that baby. So it just kind of depends on where you are,
Right.
and what you're doing.
Right. Wow.
Makes sense.
Yeah.
Good stuff.
I know I had a procedure done.
Mhm.
I think it's with my thyroid. That was like on my I think some cyst was on my ovary,
Okay.
and I had it that we had to take like had to go in to see was the cyst was cancerous or
Mhm.
whatever,
Mhm.
and I think they had to do the microscope thing too first to look
Okay.
at it and then
Okay.
pull it. It didn't feel good. It was
I'm
a
sure
very,
it
it was
did.
very, it was. I got a high pain tolerance, but it just wasn't. It was definitely uncomfortable.
Yeah. Yeah.
But
Yeah.
to have that done, to know, because I had heavy period,
Okay.
and I used to bleed through everything, so it's like they needed to see, make sure it wasn't cancerous or that's the
Mhm.
cause of it.
Mhm.
But it was just, I think, thyroid. That was like
Could be.
because it was like that, so it wasn't cancerous. But I'm glad I had it done. I
Mhm.
recommend everybody, if you have that problem of you bleeding a lot,
Mhm.
and I went through. I can go through 2 pads less than 20 minutes. That's how I was going through, like big bad. It was bad. So it was like, but I don't know. I thought maybe something wrong. So that's why I went to the facility to
Right.
see,
Right.
and go from there with the Rice Center. So, and that's when they did all the procedure, but found out it wasn't cancerous. It's just my body just throwed it out like that. It just throw it out.
See,
like
they just throwing it out like that.
My body just throw it out and find out I was fine. Actually, I'm like, oh,
So
okay.
it wasn't
So
thyroid or anything.
it was the thyroid, but
Okay.
nothing like anything that
That's-
the doctor was alarmed about. So it's just
See, I know a lot of people that do like have heavy menstruals, and they always end up having a hysterectomy.
yeah.
Yeah. You
Thank God I didn't have to.
Yeah.
you
Thank
can
you,
or you. It depends.
Is that an
Mhm.
option, or is that okay? No,
It
we have
depends.
to do.
The only way we would have to do it is if it
Mhm.
comes back and it says it's cancerous or precancerous,
Gotcha.
right?
Okay.
So then we're like, all right, like at that point,
Mhm.
we need to remove it,
Right.
all right, and then we don't have a lot of options. You want to rule it out because some people could just have heavy periods,
Right.
right? They can just have crappy periods. You're like, I just have a crappy period,
Mhm.
but you want to rule out and make sure what it is, and then once you know what it is, it's kind of like, okay, I breathe better. I just have a crappy period. Now,
Mhm.
there are things out now, like we can do endometrial ablations. Like back in the day, like with my mother, hysterectomy was the answer. So everybody, if they bled, they were done having kids, they're like, yeah, take it. Like, I don't care. Just throw it away. I don't want it anymore. Now there are ablations and things like that. So now we can just remove the lining of the uterus. So then you still have your uterus. It's less invasive. I always tell people, let's try it.
Mhm.
Because if it works, you didn't have to go through a major surgery,
Mhm.
which you're off for 6 to 8 weeks. You got to go into the hospital, all those things. Where an ablation we can do in the office and we're done. The procedure takes 2 minutes.
Right.
So
Okay.
you go back to work on Monday. Like there are no stitches. There's nothing like that. Like
Okay.
everything just happened kind of internally. And I was like, if it works, great. If it didn't, fine. We'll go to a hysterectomy. But let's
Right.
try it. So there are options.
Okay.
If some people don't want that, like they might just put in an IUD and be like, okay, I'll keep that until I go to menopause. That's fair too. As long as we rule out that it's nothing precancerous or cancerous, the
Mhm.
world is
Mhm.
open to you. We can do whatever you want.
Mhm.
But if it's something precancerous or cancerous, then we start to look at that is our option.
Okay.
That is our option.
Good
Okay.
stuff. Thanks for sharing that, Keith.
And I would say this too: if you bleed after you're in menopause, and if you ever bleed, I don't care if it's a spot or a white, come see us right away.
Really?
Wow. After the menopause.
Mhm. Because technically you're not supposed to, right?
Right.
Once you enter menopause, you should not see blood anymore,
Okay.
right? There are some people who do, and then you're like, let's watch it, let's see what's happening. And I've had experiences where you do it, and then they'll like their body will just wake up and sucks. But we wonder, why did it wake up? I've had some, like I remember one lady, I had to talk her into it, and she's like, it was just a spot. I was like, man, we're not doing that. You haven't had a period in so long. Like, this is what I recommend. She fought me on it, but we did it. And unfortunately, she did have some low-grade cancer. So we had to send away. Like, that's why. Like, it could have
Okay.
just been a spot. I've had
Mm.
some who had a full-fledged period, and then we do it, nothing came back.
Mm.
And every time they do it, I'm gonna keep going. And sometimes we may start to find something later. It could be 2, 3, 4 years later. Like, it came back, but just if it ever happens, make sure you see it because that's not supposed to happen.
They
Okay.
can have kids too, can they?
Not necessarily. It's not necessarily
Okay.
that you woke up and had a those menopause babies are the ones that weren't really in menopause yet.
No.
And you thought that
Okay.
you were,
Mhm.
and you haven't had a period for so long, and then you look up and say, "Well, I'll be."
Wow.
Yeah, but
Okay.
once you've been in it for a while, like if
Yeah.
you've been in it for like 10 years or so, the likelihood of that is very, very low. But those menopause babies, they weren't really in menopause.
They weren't
yet.
really
They
in
just kinda-
menopause. Okay.
Okay.
Makes sense.
So
the
Makes
eggs
sense.
snuck through.
So why do you think women have like more experience of anxiety and depression when they're going through menopause? Do you think have you noticed anything like depression and anxiety of them when they're going through like the menopause period?
I've noticed more anxiety than I would say depression.
Gotcha.
There are people who they have mood
Mhm.
changes.
Mhm.
I tell people their patience gets short.
Oh.
They don't have a lot. It's either yes or no. Like we ain't finna be having all these conversations, either do it or don't.
Mhm.
They get real impatient, and then I've had some they're really anxious,
Mhm.
and they're like, I was never this anxious before. Like I'm
Mhm.
anxious about everything. I'm anxious about driving. I'm anxious about this. Like everything takes them over. I see that more so than I see the depression. I have seen some, but I see more of the anxiety and more of just the impatience and kind of the, all right, let's get on with it. And when I was doing, hormone therapy, it would be funny because people would go, yeah, my husband was like, it's your time. Like, it's time for you to go get your stuff. You get a little snippy, a little snap, because that impatience starts to come back. And, so then they're like, you get a little snippy. Let's get that together. So
Right.
those kind of things.
Okay. Okay. All right. Wow. All
That's
right.
good stuff. Good stuff. So if you are, and I don't know why we keep going back to menopause, you can tell we older.
That's fine. That's fine.
Yeah,
That's fine. If that's where you are, that's where you are. You pass another stage like, I can't no more.
Man, no, it's just for people that really don't know. I think I'm in menopause. I think I'm in premenopause. How are like the indicators other than you can really know like, okay, this is finally it. You're there.
Blood work.
That in
Blood work.
blood. Okay. Oh,
Mhm.
okay.
Mm.
Then okay. So see you hear that, ladies? Blood work. Go see your doctor. So
Yep.
and this is where a lot of us just assume.
Yes.
You know what I mean?
Yes.
And this is the important part about having a conversation. Like, don't
Right.
assume.
Right.
There's professionals out here that will let you know what's going on. with
And I would
everybody.
say definitely make sure you go to someone who checks all your hormones. Because a lot of primaries don't, right? They don't
Right.
look at your FSH and things like that because that's just not their wheelhouse. So if you do it, be like, hey, look at that because I want to see what that is. Or if you still have a gynecologist,
Okay. That's
9 times out of 10, the gynecologist will.
Okay.
Like that's their wheelhouse. So they're gonna look at that.
Mhm.
Okay.
And how often do you think you should see your gynecologist?
I still say yearly. So there are studies out there that say that you can go every 3 years, like with your PAP and stuff like that. I am a woman. I have a vagina. So I don't go with that because what if something develops between that time period?
Right.
And I get it. Like when I sat in the course and they were talking about it, it made sense to my medical mind, but to the woman that has the vagina, it didn't make any sense. So at this time, insurance companies right now are still paying for them yearly. So I would still do it yearly. I know it's uncomfortable, but at best, what is 30 seconds?
My doctor told me, well, now that you hit 50, I think she said like maybe
3
every
years.
3 years, and
Mhm.
perhaps mammograms every 5 or something.
Absolutely not.
Okay.
I wouldn't go that far.
Okay.
Unfortunately, and fortunately, right? If you ever get a diagnosis of breast cancer is one of the one things that we got that we can treat. And
Okay.
people like,
Okay.
God forbid, if you ever had to hear the C word and they said breast, okay, I know they
Right.
got options. Like they know what to do with this one. As opposed to there's some cancers they don't. And
Right.
so you're like, okay, they're really trying to figure this thing out, right? So I would definitely just get them checked because a lot of times, example, a family member of mine had their mammogram completely normal. 6 months later, it wasn't.
Right.
And so sometimes it was like, I'm just having this pain. And they had cystic breast, so they really couldn't tell. They had their doctor's appointment. They went back in and was like, yep, this is cancer at this point. So
Mhm.
it's like, if you waited 5 years, then what did that look like?
Mhm.
Like that,
Mhm.
You know
we'd
what I
be too
struggle-
far down down the line.
Mhm.
And you know what I struggle with now, Miss Darshell? I see a lot of us who have been diagnosed with breast cancer
Mhm.
or who may be getting a form of cancer. And I can't help but to question in my mind, I'm not going to ask, where did they go wrong where doctors could not catch it? You know what I mean? Early signs are always good. Like you said, we can catch it.
Mhm.
You know, so do you see a lot of that?
I would say yes and no.
Mm-hmm.
I would say yes and no.
Mhm.
Sometimes people are, like I said, I had a family member, they were on it,
Mhm.
right? And they caught it early. Sometimes things hide and you can't. Like pancreatic cancer is one of the worst. And I've been affected by that in my family as well. By the time that comes up, there is no sign. There is nothing until it's already hit stage 3 or stage 4. So that's why I say when there are certain things, like breast cancer is one of those things that
Wow.
we can find early, we can do something about it, and you have your best outcome. There are some cancers out here that's not the case.
Mhm.
Like I know when I was doing my family practice, she used to, if you smoked, you got a chest X-ray
Mhm.
because you could be at risk for lung cancer.
Mhm.
There are not a lot of people who do that.
Mhm.
They wait for you to cough or wait for you to, you know, whatever's going to happen if it happens. So there are some things that there are no screening process. Like there is no screening process. So you wait for the body and like have blood work all the time. Everything's still come back great. Because it's stage 0, stage 1, a lot of times those things aren't popping off yet. You know, stage 3 or stage 4, and you're like, wait, something's wrong. We're behind the 8 ball now.
Mhm.
Right.
But that's what I'm saying. So those things that we know that we can test early and kind of be ahead of, you know.
Mhm.
And a lot of times too, it's, especially in our community, we're still scared of doctors,
Absolutely.
right? We do not trust the medical community.
Right.
It just
It's
is
just
what
what
it
it is,
is.
right?
We're not that far off, right? We know them. Everybody got the sugars and they got the pressure, and you just gonna treat it like this and take, you know, olive oil and take oregano oil and do this and do that, and it's gonna make it better. It can, but sometimes it may not. And we're still kind of scared. And so sometimes, and especially too, if we're being dismissed, if we go to the doctor, then we're like, well, what do I go for? Because they didn't listen to me anyway, and they didn't do whatever. But keep talking. Now that people are talking more, and now that you might have to just find that person that listens. You might have to just find that person that clicks. I always tell people it's like finding a psychiatrist, right? I always tell people when I send them there and I feel like they need to go, or a therapist, you might not click the first go around,
Absolutely.
right? It's like dating, unfortunately, right?
Right.
Your first boyfriend you ain't with, you might not be, that's very rare. But you have to find it, and you have to let them know what you require as well. They're going to tell you what they require. So now you tell them what you require and how you receive information. They're one person, so they see a lot of people. Some people aren't adaptable to kind of changing to who they're talking to or how they receive information or those kind of deals. So you got to be upfront too. Like, I don't know what you're talking about. Talk to me like this, or say it like this, or talk to them until they'll do it. Some won't. Okay, that means you're not for me. So now let me move on.
Right.
And like I said, now that people are having conversations and more like, and our grandparents did, my mom, they didn't sit around talking about menopause and that kind of deal. But now that we are, then you could be like, hey, who you go to? Because this person over here not doing, you know, use what you got to kind of get, you know, what you need to get, and to get where you need to be. And unfortunately, you might have to search for it, but it'll be worth it in the end.
Yeah, I tell my son all the time, you have to be honest, whatever. Don't go into the doctors not telling them half-assing or not telling them what your symptoms are, because then you're not going to get what you really need.
We can't help you if you don't.
Absolutely.
And I always tell people, once the door closes, there's no judgment zone on my part, right? It is what it is. I don't. Let me help you. Like I don't care. And once the door closes, the door closes. So what happens behind these 4 walls is what happens behind these 4 walls. But let's get to where we need to get to, so we can get you the help that you need.
Right. Do you think a lot of in the Black community, people are either maybe embarrassed, shamed to really address their symptoms, whatever symptom it may be? You know, how do you open those doors for people to be comfortable to talk? Like you said, some people are scared of the healthcare doctor.
Right.
You know, how do you get them to be comfortable to even take that step?
I think just if your provider is personable, it's not hard.
Mhm.
right? And then once you figure out that you can talk about other things, because when people are in rooms with me, I know everybody's business. I know,
Right.
you know, we talking about your kids and your husband and this, and I'd be like, yep, my husband do that too, yep, or you know, I get that too, or yep, my mother was, she was doing that too, you know. So you start to be relatable,
Absolutely.
and once they realize that you're relatable and that nothing's kind of off limits, let's have a conversation here, then they're willing to say, hey, some things are just like you. Do I talk about sex with this person? Do I, you know, my family, even my best friend laughed. She's like, why are you in the room so long with people? I am not in the room that long. I was like, don't be hating because your people don't be talking to you. I be talking to my people. But it's like, don't be hating
I
because
promise you, I have a good relationship with my gynecologist and my primary.
Yeah,
like, look here, doctor.
Yeah, it's a good time.
You know?
We're here telling jokes. It's a good time. I remember our coworkers were like, y'all be laughing at that. Don't be jealous. Don't be jealous. We're having a good time. And I think once those things kind of come down and they're like, okay, I can say this. And if you throw something at me and I'm like, girl, why would you do that? Then I would never say nothing again. But if I'm just like, okay, well, let's talk about that. Let's do this. And then come relatable, they're like, okay, yeah. And then this happens. All right, yeah, let's get to it. And then let's figure it out. And I think that's how that just kind of.
Yeah, you have to have a good
just kind of break that down.
Relationships are very important. I'm just open about my body. You know what I mean? Look, doctor, I tell my let's schedule me an MRI, please. So my back ain't right, doc. She be rolling.
She's like, all right. I just like, I don't think it's that, but go ahead. You get your MRI. And I mean, it is what it is. Like, I don't fight people on. It's not worth it to me. I'm not gonna like I might say, hey, let's do this first, okay? And I might tell people like, hey, let's try this first. And now with the internet, it's kind of hard, right? Because the internet tells the patient one thing, but we're like, no, like we need to do it this way first. And it's like, but they gotta trust you. And I always tell them, I'll do that, but let me try this first.
Yeah.
And if I don't hit it out the park, then I'm coming your way. You know, let's try it this way. You know, and let's have a conversation. And why you want to go this route before we try this route. Let's talk it out. Because it's your health at the end of the day. It's you that has to deal with that. So let's talk about it.
That's how my doctor was with my weight loss. So we went through all, and you have to have doctors that will explain what every medication you want. You can't go in and tell you. You're a professional. I'm gonna just tell you what the symptoms are, what may happen. Now we go, like you said, you got to listen to these professionals and medical doctors and give them a chance,
right?
You know, because it's your body at the end of the day.
But, and you make the ultimate decision, but I want you to make the best informed decision. And as long, let's go. But just know this can happen and that can happen. Because you have that, you go and they be like this. I said, we talked about this, remember? This could happen, right? It's like, yeah, we did. Okay. So we're either gonna ride it out or we're gonna move on, like whatever you want to do. And it's like sometimes you gotta remind patients, like, we talked about this, but you wanted to go that route, so that's where we are.
They get not trying. Oh, last time you
I was like, remember we had that whole conversation. You would call me and I said, yeah, we went here. So that's okay, and we'll ride it out. But I think just to make the best informed decision that you can,
right,
then that's what we do.
What is the most, and like when you do see the women, what are they questions? One of the most questions they do ask at appointments.
If we talk about as far as menopause or those kind of deals, like one, like where's my period or what's happening, they just don't feel right. I hear that a lot. Like I just don't feel like myself. Like something's just off. They can't really pinpoint what it is. Some things are just black and white. Like I got hot flashes. I got these moods. I have low libido. This is getting on my nerves. That is okay. All right. So those are like the most common things. A lot of body aches, joint pains. Of course, weight is huge. I hear the weight a lot. Those are big ones.
Okay. Let's turn that shift on weight loss.
Okay.
Because as you know, it's really big. Even with me and myself, and I'm be completely honest. You can just tell me, because I discuss it all with my doctors too. Because sometimes we need a little kickstart. What in your professional experience, the Ozempics, the Mounjaros, the Phetamines, all the weight loss pills? I know you see it a lot. What's your take? No good. It is what it is.
I prescribe them, right? I feel like they've taken the medical community and kind of put you in a stronghold. You really don't have a choice at this point. But I think things have their place. All right. I do think that there is a group of people, men and women, right? This is not just a woman thing at this point. There is a group of people who do need that help.
Absolutely.
Right. And do need that jump start.
Mm-hmm.
And I'm with that. I am not of the science or belief that this is something you're going to be on forever. I'm so not with that belief. And I just try to tell people that from the beginning, I'm not going to prescribe this forever. So
Right.
I always try to say it like this. I said, people are living longer. So you 45, you going to keep doing this injection till you 85? Like, no,
Right.
I'm not doing it. So
Right.
my goal is to get you where you have to be.
Mm-hmm.
When people talk about gaining the weight back and all those things, a lot of times people do because you're not doing the work that needed to be done beforehand, right? So you gotta still, it takes your appetite.
Mm-hmm.
So no, you're not eating as much.
Mm-hmm.
Your portions are smaller. Yeah, I remove it. Now it's back.
Mm-hmm.
You don't know how to control that
Right.
because something was helping you do that. Were you exercising? You should be, because now you don't want to lose the muscle. So you need to exercise so you don't lose your tone and you don't lose your muscle. So if you don't have a routine, and even if I do Phenermine, once I pull off, if you ain't done the part, we're back here. And I don't care what it is. If it's a GLP-1, if it's Phenermine, if it's Weight Watchers, if it's Jenny Craig, I don't care. If you don't do the work, I used to tell people all the time, Jenny Craig, yes, had a place. Did I like her? No. This is the reason why, because you have no idea what your calories are. And let's be honest. If somebody has a wedding or graduation party or something like that, you're not taking your Jenny Craig with you. So now when you get to this wedding or you get to this party, it's done. It's shot. That whole day is gone. Because now you've thrown it off.
Right.
As opposed to like Weight Watchers, at least you're eating your own food. They let you can go to dinner with your friends and figure out what you can eat and figuring out that portion control and those kind of, that is a better move. Jenny Craig is to help you get it off like this. Nutricip, they're just to help you get it off like this. And I think those are for people who are just like morbidly obese and we need to just start pulling weight quick, just because of health concerns. But yeah, that they have their place, but losing weight is hard. It's hard and it sucks. And sometimes there are hormonal things that go with it. Sometimes you could be so imbalanced that your body is not allowing you to lose the weight the way you need to. So that's another thing. You look at the hormones. If I balance them back out, I might help you get to where you need to get to, and I might not need to do those other things. So, yeah.
How about someone who they metabolism run really high, and so
Bless your heart.
they never.
Bless your heart.
I know,
Because mine don't.
it's like you can gain weight, but then if you not eat a day or two, you lose it. And it's not. It's really not. I think it's a struggle for me because I cannot balance. It's like I cannot balance it. It's like my metabolism runs high. So if I even get sick 1, 2 or 3 days, I lost everything that I worked hard for. So it's like I gained that weight and I gained that muscle. Then now I'm sick. So when I'm sick, I lost the weight, everything I waited. So now I got to do it over. So the process, I keep doing this a lot. So it's like, how can I balance that? I want to keep gaining to build more muscle, but I can't keep gaining because I gotta constantly eat because I eat fish. I only eat fish.
Okay.
So only fish, vegetable, and fruit. And I'm just having the hardest.
That ain't my diet.
I'm having the hardest time.
Eat some meat.
Listen, I put like a steak in, but it depends on the type of steak, right?
Okay.
So I put a steak in once a month.
I ain't even a medical professional.
But have you tried eggs though?
I eat
as a source
eggs
of protein
every day.
You do smoothies and stuff
every day
to try to put like extra protein and stuff like that in there because you need to try to get it.
Yes,
that's
I take 100 protein a day, only when I'm not sick. So,
well, how often are you getting sick? Because this ain't right.
No, it's like it's not. But then sometimes I don't want to eat. Like, okay, So like, okay, I have like I say I'm gonna splurge and get a burrito, you know.
Oh.
So get a burrito. So I'll splurge
Y'all
and do
hear
something
this?
like that, right? So when I do that, oh shoot, hold on,
Pause for a
everyone.
minute. You know, TikTok always give us this timer thing. We got to reset.
Oh shoot, hold on.
Sorry. Pause break.
Okay.
We got a skinny
Sorry,
one
everyone.
talking.
Sorry. Okay. So I eat that. I'm not sick. I don't get sick often.
Okay.
So it's just the point is I have to force myself to eat.
I
So
forget
that's
that.
my issue.
I
I
get
have
that.
to force myself to eat, and then I don't want to eat, but I eat ice a lot.
Are you anemic?
No, and that's the thing about it. I already did well, I had some things I wanted to do. So I took a lot of the iron and
Supplements?
brought my iron up.
Okay.
So I don't, but I like chewing it. So that's like my gum. It stops me from chewing. I don't know if that's like a nervous thing. So I can tell you.
Okay.
I don't know, but
Okay.
so if I don't have the gum, I'm eating number ice. I mean ice comes because it's like something I need to chew
Okay.
on.
It's like something to do.
Something to do. It's
Like I just tell
weird.
people who smoke after a while, if you smoke for a while, you're not smoking for the nicotine effect anymore.
Yeah,
You're
I'm
just smoking
weird.
because that's a habit. And
Right.
that's just what you're used to doing.
Yes.
And that's what it sounds like.
So what can I do? Like, okay, I don't want to eat. I don't eat chicken. I don't want to eat meat really, but I don't want to eat steak like that. Once a month is pretty good for me. I feel
I'm
once a
proud of
month
you.
is
I'm
pretty
proud
good
of
for me.
you. Okay.
So I know I'm eating the eggs and
You're putting in like smoothies and stuff. Are you doing like oatmeal and stuff like that?
I don't
Smoothies
I
and
don't
stuff?
like oatmeal.
You like it in smoothies though? I don't like oatmeal either.
I got
At least
cottage
the oats,
cheese.
If I do oatmeal,
So you want to put the oatmeal?
but they
in?
do like the oatmeal smoothie. The overnight oats is what they call them. Let me stop calling them oatmeal
Okay,
smoothie.
overnight.
They do like overnight oats, and you put like fruit in them and stuff like that, and people are able to do it that way. So I'm like, my mother hates oatmeal.
I hate oatmeal.
I can't do it. I'll gag.
Me too.
Really?
So that oatmeal is not my
maybe
jam.
just like
Yeah.
regular oats, maybe, or you do it like oats and honey.
But see, this is my thing. Okay, all right. So
Texture thing?
I got issue.
Okay.
Half everything is bioengineered. I can't do it.
That's fair.
So that's like my mind won't allow me to do it because every time I see on the thing it said bioengineered. I have not been eating that. I'm already mad because I've been
That's fair.
eating. I love cornbread, but I can't get regular flour because it's bioengineered, and I want to get my cornbread, but I can't get my cornbread.
Well, you're
because
gonna
of
have to
that.
do like the Trader Joe's, the Whole Foods. You're gonna have to find those organic
I
stores,
know.
which sucks, which is another thing that we talk about, right? In our
Right.
communities, there's not a lot of those, and then when you find them, it's expensive as all get out.
Exactly.
You're like, what am I supposed
I'm
to
at
do here?
200 every time,
Yeah,
Yeah.
yeah. I'm with you.
and I'm by myself, so
I know.
that's not good. It's not good. I'm by myself, so it's like, yeah, you know what?
But I get what you're saying though, because yeah, we know
Oh,
that one over there. Ain't got no
we know
problem with that.
My
But-
daughter do not play, but go ahead.
So on both sides of the spectrum, right?
Okay.
A lot of my weight comes from that I don't eat. So you go in starvation mode, right? People don't realize that, right? Because you can eat too much,
Right.
but most people who do, they're not eating like that. A lot of times they're not eating, and that's why they don't understand it. Like I had one meal a day. Your body
I see
works
YouTube.
24/7,
Mm.
right? Your body
Okay.
doesn't sleep.
Hmm.
It needs energy.
Mhm.
They don't know when my body will not know when I'm gonna feed it again. Right? When I work, there'll be days that I get up. I'm not a breakfast person, so then I might not maybe eat lunch. Maybe I'm seeing patients. I'll pick at it, won't really eat, and then I eat dinner. So then I'm eating dinner at 8, 9 o'clock at night, and I'm going to bed. My
Right.
body's like, I don't know what you're doing.
Mhm.
So now I'm
So
gonna
I
store it
love
as
that.
fat because I still gotta work,
Right.
whether you gonna feed it to me or not.
That's true.
Right.
Right. So if you think, I always tell people to look at personal trainers and look at them. They're eating consistently. They're not eating big meals.
Mhm.
Or they're eating like they got a protein bar, or they
Mhm.
got some fruit or something, because they have to constantly put something in because they're
That's what
constantly
my son
working,
is.
right?
Yeah.
Because their metabolism is up
Yeah.
here because they got them already working, so they're constantly have to do something.
Okay.
That's where those like 2 snacks and 3 meals a day come from, and they're small. Like I remember I did Weight Watchers once. I was so annoyed. I lost weight, but I was annoyed because I didn't want to eat.
Mhm.
I don't eat like that. So
Right.
now I gotta plan it, and I don't want to.
Right.
I don't want to chew. I'm tired. I don't. This ain't what I do. So I
Right.
get what you're saying. Like when you don't want to eat, that's a real thing. I
Right.
don't. I ain't hungry.
Right.
It's like stop trying to make me be hungry right now because
Right.
that's what I'm not.
That's it, yeah.
Right.
Yeah, and if you don't work out like that, I ain't burning it. So
Mhm.
what am I doing? Like,
Right,
kind of like,
just
what am I doing?
confused,
Like,
yeah.
I'm just mad. And I'm just eating this carrot because I just supposed to, but I'm mad about it.
Just so I don't go into
Yeah, and I mean, I
survival
lost
mode, yeah.
weight, but it was like, this is a bit much. I'm
Right.
counting points. I gotta eat. This is too much for me.
Right.
But I mean, once people get into it, though, it's not too much. But like, I get it from both sides. Like,
Right.
that's just what happens. You might need to see a nutritionist though.
Okay.
Yeah, because they might think about Kiki.
Yeah.
She
I
eat her
was
little
saying-
one egg and her little. So you see her refrigerator?
It's 2 eggs.
It's 2 eggs.
Two
Okay. You give you 2 eggs.
Yeah.
2 eggs.
Well, I was seeing nutrition, so you know, like, what you can do to stick.
Okay.
Like, what is it that'll help it stick?
Got you.
kind of a
Okay.
deal.
I'm gonna
Yeah.
do that.
Oh,
Yeah.
when you work, didn't work you do. You still
Right.
burning.
And you're up and down the truck. Like
Yeah.
that's
I work out every day.
yeah.
You know, I lift all the time, and it's like
Yeah.
I have it. Oh man, it'd be perfect. Then I don't eat, and I'm like,
Your body like hello.
But-
yeah,
Mhm.
and then it's just
Yeah. Then it goes away.
Then I
Yeah, no,
lose
I
it.
get it.
So,
get it.
someone has a question here. So, TW2715, how does one balance their hormones without pharmaceutical drugs?
So you can look into, depending on like kind of what your symptoms are, is how we would kind of gauge it. So those the company I talked about, Metagenics, is a good company. You can order, you don't need prescriptions from anybody. You can order those online. So you will go online and they have an array of things for perimenopause, menopause. They have things just like women, you can look at stress, all kinds of stuff, and look and see what is happening for you. And then you can go in and decide what's the best vitamin. They even have like a multivitamin pack, and it's like a lot of stuff in there, like a vitamin D, and it's like a whole thing. I remember when they came to the office one time and they showed, I was like, there's a lot of pills to be taken, but they addressed each individual thing. It was real. I was like, all right, I'm with it. It was a lot of things to take there, but I would start there. Like you definitely don't have to do hormones. There are companies that Metagenics is just one of those good companies that I know that you can go out there and figure out exactly what your symptom is and take that, and then that can help what's happening and kind of balance you out.
okay.
Sounds good. And then she also says, same person, alfalfa will help you put on weight, avocados, and nuts.
I've been learning to eat avocado, and I do eat peanuts, pecans. I eat nuts a lot. I'm pretty big on health, so I eat nuts a lot, and I've been learning to eat avocado. So
Avocados are wonderful.
Yeah, they are.
I've
Do you
been-
do avocado toast? This is a good fat.
avocado
Yes.
what?
Toast.
What you do? What you mean? What you do that? What you do? What you mean? Like
It's
put it on
toast.
some bread?
Yeah.
Oh, bread, be man.
You know what?
Oh.
Okay. Well, let's.
You know,
not-
so because you got okay, on my side of the family, we got what is that?
heart disease.
No, with the kidney thing. What the
Okay.
kidney thing is.
Which
The
not the sugars.
yes, the sugars. It's the- we got it big on my side of the family.
This is
the
a girl
sugars.
from the country.
So
Okay.
I
you-
I
don't
know,
want-
right? I don't know why she's trying to get the sugars.
So I don't want to be like, you put all that bread in, and I'm already, I don't really eat that much sweets as much, but I do make a sweet potato pie often. I'm just saying.
I think you make it during the holiday. You do not make it past the holiday.
I do. They said sweet potato is good for protein, so I put it at the crust.
And
That's the only bioengineer I get. That's the crust.
but they got like zero carb bread. Like they got the low carb
Oh, they got
bread
low
and like
carb.
the whole wheat
So
bread.
they put it on
your
there?
bread.
Yeah.
So
Nasty,
you just
but hey.
slice
Yeah,
it.
it's like you slice it. Some people make it almost like it's a guacamole. You can put like tomato and stuff like that in there, and then put it on top of the toast. Yeah,
It's so
Oh,
good.
I didn't
you
know
put your
that.
egg on there too.
Yeah.
Oh, I didn't know that.
Yeah.
So
Okay,
good.
what's the
Dunkin'
toast?
Donuts sell them, but they not if
I
you
don't
make your
eat,
own.
I don't eat fast food and other stuff. I don't eat that. Yeah.
So yeah.
I don't eat fast food.
That's
Yeah,
fair.
so okay.
Good for you. I like that.
Thank
Your daughter over there.
I like that
Fresh.
for you.
She said not the two
I don't know.
eggs.
I'm a head case. I don't know. I guess.
No, I
So-
mean, hey, but honestly though, because you don't, with diabetes being hard, on that side of the family, like
Right.
prevalent, you
Yeah.
don't do half of the things that could kind of get you there,
Okay.
right?
Right.
You're not eating the fast food, so you're knowing what's in your food. So you're not
Mhm.
doing a lot of the processed. You're not
No,
doing a lot of those
I
type
don't
of
do none
deals.
of that.
So that's where a lot of that comes from.
Oh, okay.
A lot of that comes from us eating out more.
Mm-hmm.
You know, I always look at it as, you know, back in the day, right?
Mm-hmm.
Grandparents, they, you know, about the Crisco oil on the oven and the salt pork and all of that.
Mm-hmm.
They didn't have as much stuff as we got.
Right.
But because they still made their own food, so they knew what was in it.
Right.
And they were still more active than we are.
Gotcha.
We are more sedentary.
Mm-hmm.
We eat out more. We work more. I think in those, like, we're like, yeah, we can work, and, you know, we're working all night, and then and so then we're eating stuff and going to bed and all that kind of stuff. So
Right.
I think they have more of a balance than we did.
Okay.
I do. I think they was like, look, I work 9 to 5, and that's about it.
Yes,
Okay.
yeah.
And like my grandmother didn't work, right? So my
Mhm.
grandfather did what he did. He came home, and that was that. You know, now you a lot of times it's 2-parent family. They're working. They're doing
Right.
it. You trying to find time. Like, I'm
Yeah.
tired. I'm
Right.
not cooking.
Right.
You know, we finna eat that because that's what it is. I'm not
Right.
finna do it.
That's
Right?
it.
I'm not
You
finna
will-
do
Right,
it.
yeah.
If I didn't prep it though, it sucks. Because we
True.
finna eat out. You know, and that's
Mhm.
just where we end up, as opposed to
Mhm.
back in the day, like my grandmother didn't work. Eating out was a treat
Okay.
It
because
really
they cooked
was.
every day.
Mm-hmm.
Yeah.
They cooked every day. So eating
Yeah,
out was a treat. So
I
they
know.
knew what was in the burger.
Right.
They knew what was in that food. We don't know.
Mm-hmm. And yeah, I know.
You know?
At
You
all.
see McDonald's burgers this thin. I don't eat McDonald's, but I'm saying
Mhm.
nasty stuff.
I haven't seen it.
I wish I would.
Mhm. Mm-mm.
That was so funny.
All right.
That's it. But you got any more?
No, that's basically, unless anybody else got any more questions.
I don't see any on YouTube here. You want to walk? I don't know. You remember how last week we seen all those?
Yeah, but I don't see nothing.
Okay.
So
That's
I think
all.
we all good.
All right. Any
Oh,
last minute words, Miss Darshell, that you want to put out here about health, wealth, spirituality, mental health? Oh, you see a lot of that.
Mental health is real, and I
Mhm.
think we need to not be scared of it.
Mhm.
I'm a Christian. I believe that God is first and foremost in everything, but I
Most
also believe God placed people here for a reason.
Mhm.
He made social workers for a reason. He made
Mhm.
therapists for a reason. He made psychiatrists for a reason.
Mhm.
And we should not be ashamed to
Absolutely.
take part of that.
Right.
And it doesn't mean something's wrong or you
Mhm,
can't
mhm.
figure it out or
Mhm.
why can't I make this work?
Right.
Because you just can't in the
Sure.
moment, and it's okay.
Mhm.
And you ain't got to announce it to the world either.
Mhm.
That's where you're going. If
Right.
that's what you need, that's what you need.
Mhm.
And you might need that help. It just is what it is. And I think
Absolutely.
we don't need to be scared of that. And sometimes it's good. I always tell people it's good. Sometimes talk to somebody who don't have no bone in the fight. They
Yeah,
don't know
yeah.
you. They can't pick a side.
Right.
They can listen and offer advice.
Mhm.
Know that you may have to work a lot to find the right therapist. It's like
Absolutely.
dating. You got to work to find the right therapist. When you find the right one, it's not a bad thing. And our counterparts use them a lot.
That's true.
Mhm.
They go sit, just have a whole conversation, be
That-
like, great, and
man,
then they
I
walk
seen-
away. And sometimes it's good to just give it to somebody else. Like, hey, you help me figure this out
That's
because
true.
I can't right now.
'Cause people can't. Their
yeah.
memory, their minds are not even a place where they can even be rational and just come back. So
Yeah.
I don't think we touched mental health yet, have we?
No, we haven't.
I think that's most critical.
Mhm.
And it doesn't mean that because you see a therapist that you don't believe that God can do,
Correct.
because God can do. But God can use a lot of things to get what he needs to get done.
Correct.
And so sometimes that is seeing a therapist. Sometimes that might be taking medicine to help you get over the hump that you're at. It doesn't mean you have to be there forever.
Right.
But if you need the help, you need the help.
Right.
And I'd rather you take it than not, because sometimes the
Right.
detriment of not taking it
Right.
is not worth it.
Absolutely.
Gotcha.
That's not
Good
worth it.
ending.
Any more questions
Perfect.
up on that? YouTube?
No, just someone said, thank you so much for bringing your expertise to the discussion. We appreciate you taking the time off your busy
Yeah.
schedule.
Of
Absolutely.
course.
Yes.
Of
It's wonderful.
course.
So, a
I really
very good
appreciate
conversation. I think this can go on and on and on.
Yes.
You know, I don't know who chimed in, but a lot of people really need this, and I hope if it helps one person, you know, thanks for chiming in on YouTube. Really appreciate it.
Yes.
We're just trying to reach the audience that doesn't know
Mhm.
you know, and just know they're not alone.
Right.
There's resources out here,
Mm-hmm.
you know, and as Black women, we standing strong in this fight.
That's
Bring
it.
awareness. That's
That's
what we
it.
do.
standing strong, and you know, and that's all we're trying to do with this
Mhm.
podcast. But
Exactly.
you have to come back on again,
Yeah.
man. I mean, mental health.
Yes.
Okay,
You know,
talk
we
about all
got
the
so
things.
much. You know,
Yes,
we have so
I
much to talk.
Definitely mental health. We definitely would like to discuss
Absolutely.
that. That is really important. That's one of the big ones we said we wanted
Absolutely.
to talk about is the mental health, because a lot of people are dealing with it. We a young man, he was an NFL, 25 years old, killed himself.
Like recent, that was recently, right?
Uh-huh.
Yesterday or the day
Recently
before?
killed
Oh yeah,
himself.
yeah.
Mm-hmm.
Yep. So it's most definitely needed, and I see it in my field.
Mhm.
I've been a social worker for some time,
Mhm.
so it's definitely like a 2 or 3 way,
I'm telling you,
you know, conversation to be had.
especially even truckers.
Yeah.
Truckers
Especially with
deal with a
Black men.
lot
Yeah.
of mental health.
Yeah.
Truckers does, because
Yeah.
they out there on the road, and they
alone.
they by themselves, and they ain't got nobody to talk to, and they don't. It's a lot going on. A lot of truckers been found dead in their truck.
Yeah.
Yeah.
And
Yeah,
check
but-
on your people.
Check
Yeah.
Check
Most
on your
important.
people.
Yes.
That is true. So
And
conversation that's going to be had real soon. So
the word of the day.
oh yeah, we're
Yes.
gonna end with Kiki's word of the day.
The
And
word-
what do we have here, Miss Key?
The word of the day is delusional.
Delusional.
Okay, guys, delusional can be in so many different ways. That's relationship, that is your health, as what you believe, and what you're doing in your life. Sometimes you can be very delusional. I'll say this: I have wrote some things. Okay, so bear with me. I feel like a lot of people are delusional, not realizing it, that they think they are helping someone by correcting them or telling them what they should say, how they should think, or how they should say and act. But really, that is just trying to control them, control the person that turned them into their what they prefer when you're in a relationship or trying to develop a relationship. That's not love, that's control. And a lot of things that people don't understand, if when you align your life with God, He will send you who you need, not just who you want. Real love grows slowly, not that you're trying to find what you can love about someone. It grows. You're supposed to enjoy each other. It becomes the best kind of relationship, not based on looks, surface attraction. Yes, attraction matters, but it should be that shouldn't be everything. What matters most is how that person treats you, who they truly are, and their character. You should love someone because they are genuinely themselves. So let people be themselves. If you go into a relationship trying to find something to love about that person, that's already unhealthy. Unhealthy relationships about accepting someone as they are, that's healthy. When you truly accept someone for who they are, loving them become natural. Many people say I always end up with chaos and drama. They usually because they keep choosing based on physical attraction and excitement, not substance. You can have chemistry with anybody, but that doesn't mean it will bring peace and stability. At the end of the day, if you all have a drama, control, manipulation, or confusion, that's not love. So I'm just want to throw that out. So let's not be too delusional about everything. And it's like I'll say when I'm coaching, when I coach basketball, coach boys and girls, right? I cannot make them aggressive. I cannot make them want it. I can't make them hustle. If they don't have it already in them, that's ain't nothing I can do. I can coach you and tell you this, that, and that, and how to do it, and show you the position and tell you how to do that. But I cannot make you be that aggressive person, that drive, that determination to be that great person with that hustle. I can't. It has to be already be in. So you can't make somebody to be something that they're not, because you want to find something good about that person. What we're doing is being delusional. Why not enjoy the moment you have with that person? Laugh, joke. I think everybody's so serious trying to see, like, let's date and let's see where it goes. No, just enjoy each other. Laugh about things. Let her be herself. Let him be himself and go from there. The best people are the ones that turn out to be the best friends. they are turned out to have the best relationship because they're able to know each other. So let's not be delusional. Let's do better. Let's do better and let's be better. That's
Absolutely.
basically
And you can only, help people, enhance their skills. So
Right.
if the drive and the passion not in you, then you're in the wrong position.
Exactly. Can't make
Good
somebody
stuff.
want you.
Can we just one more question? I'm sorry, I want this
Of course.
Tiffany. I think her name Tiffany, but it's Tiffany ANIUP Shaw 2952. She says, can you recommend a diet to help if you have high cholesterol and high blood pressure?
A diet that would help. Yes. If you do a lot of eggs, we talked about eggs. Cut out eggs, but usually it's the egg yolk, not the egg white. So
I just found that
can
out recently.
Yep, you can do egg white. Do more fish. Watch your rice, pasta, and cheese.
Oh, pasta. Oh, that's my favorite.
You know what?
Oh, I love pasta.
Right, watch your rice, pasta, and cheese. For the blood pressure, watch your salt. Look at the content of things. And sometimes they might say low salt, but look at it. Sometimes those frozen meals I tell people to watch because the only reason why they can stay that frozen is because their sodium intake is really high. Watch the soups because they're great, but when you turn on the back, those sodium things are very, very high. So try to do like low sodium or no sodium, especially if you're doing like chicken broth, stuff like that. Try to do it on the lower side of things, especially for the blood pressure. Making sure that you're exercising at least 2 to 3 times a week. Just do 20 to 30 minutes. If you're not exercising already, just kind of make that a habit, and then you'll do more. But the heart will thank you for it, especially the blood pressure and things like that. But yeah, rice, pasta, and cheese.
I'm in trouble.
Watch those. Like I said, egg whites more though than the egg yolks. It's usually my biggest problem, especially if it's your LDL. If your triglycerides are up, it's probably you eat out a lot, maybe. So watch that, and it's a lot of the processed foods. So then cut back on those.
TV dinners too.
No, oodles and
noodles. That has a lot of stuff.
The oodles and noodles, they have a lot of salt.
Yeah.
Like if you turn it over and look, because they can only be
I don't eat
preserved.
them, I'm just saying.
But they can only be preserved because of that. Like
Right,
the soup, you'll be amazed. Like, oh, it's just soup. Yeah, it's a lot
I
of
make my
salt
own
in that.
soup.
Yeah, but just those things you just gotta watch.
I make my own pho.
Yeah, those are things you just
That's
gotta watch.
Chinese. That Chinese.
Ain't number
thing.
broth soup
Oh,
with some meat in it and
Okay.
vegetables. A lot of vegetables.
That's fair.
so not a lot of
vegetables.
rice too. So you can't eat a lot
They
of
do
rice.
like more the rice noodle, right?
Rice noodles.
So not a lot of rice. Can't watch out. Watch how we eat rice too.
What about brown rice?
Brown rice is better.
That's better.
It's
Okay.
better, but it's
Okay.
still rice, right?
Right.
Especially if that LDL is like this.
Gotcha.
Then those are most of my main culprits.
How about
Right.
milk?
Ew, cut it out. Ugh.
Like, what if you drink milk that's like it's like from the cow? Like it's not like Walmart milk. Like I'm not saying everybody would drink Walmart. I'm just saying what it is the milk.
She go out there and milk the cow her damn self.
Milk will give you your source of dairy. To be honest with you, I only wear out if I have cereal. Like I haven't liked milk since my
I
mother
put that
stopped
in
me from
my
drinking milk.
my smoothie.
Do almond milk.
Ugh. They don't regular
How do you
milk.
taste
Ugh.
I don't know, but I feel it.
They got vanilla milk, almond milk, cashew milk.
Oh,
See,
yeah.
well, I hate milk with a passion.
Yeah, I
If
don't like
do
milk
a
at all.
smoothie,
Okay.
But guess what? Even if I do all milk, like you said earlier, it make me gag. I want to puke. I don't know if that's me or is that. Ugh. I want
Yeah. If I have cereal, that's the only way I have milk.
with
Other than
ice,
that,
and it got to be slushy.
I don't.
And
I
the
do a
oil?
milkshake.
Milkshake. Yeah, I do milkshake a lot.
I do a milkshake. But other than just for me to get a glass of milk, no.
And we should avocado oil be better than vegetable oil and corn oil?
Yes. So your avocado oil, your grape seeds oil, all those oils are better, right? Canola oil is better than that. But also watch your portions with it though. Because sometimes too, and with the cholesterol, watch your oils. Thank you for saying that. Because you're like, yeah, this avocado oil. Well, now we done just messed it up.
Yeah, I
Because
know.
now we done poured as half of us in the
Sure.
thing.
So
It's great, but you still got to watch how much you use. Sometimes using the PAM is great because you're not going to use that much.
I use it every day.
As opposed to if you're pouring,
Gotcha.
because you're just
I
going to
use
pour a
ham
lot.
when I
frying my-
make eggs.
I be frying my my fries in there, my potato fries. I cook.
Why don't you air fry?
That's what I'm just gonna say.
Oh, that's no air fry.
You know what?
Air fry is good.
They're the country, and
I
she
know.
gotta.
I cook every day. Like I'm finna cook right now, and I'm supposed to not eat after 8:30, but I be eating, y'all.
Well, put
I
in the
own-
air fryer. You could, baby. That air fryer is a savior. You hear me?
Girl, get your air
Then
fryer.
it's gonna be all on the countertop. I don't need everything on the countertop now.
You know what? You know what? Next, can we get a psychiatrist on the camera? Do you know one? I'm tired of
You probably know
diagnosing-
one better.
I mean, I'm tired
You
of
close.
diagnosing kids.
Look, you got some with the LCSW, so they go ahead.
I'm, as soon as I get that C, I'm working on my
Come on
C,
now.
honey.
She been put me on the chair. That's what she
Honey.
been.
I ain't going to the chair. I'm gonna just diagnose you.
But air fryer is good.
Oh, okay.
Air fryer.
You can put your fish in there. You can see, oh baby,
Hmm.
Get your area.
and I could walk away. And,
Mm.
the Lord
Yeah,
is
I
able.
already
And you ain't
got-
got to use all that oil.
I got a big ice machine, and now the air fryer, and I got to figure out what to do with the air
Why you
fryer.
need the ice machine?
Because I have to have my ice every day. I eat two
Your
cups.
daughter,
Two.
she got an
Your
ice machine in
refrigerator
the
can
freezer.
give you the ice.
Ew. Not
See,
the refrigerator. Not the refrigerator ice. It's hard. You know, ain't teeth good? You're supposed to keep your teeth good, right?
Well, your dentist is not happy.
It's a soft ice.
Your dentist is not happy. Well, your dentist is probably cringing right now.
She ain't finna worry me with her dad, her OCD, and her bipolar, and her damn girl. Bye.
I know. I need help. I need prayer.
You
Everybody.
need help real
Yeah,
bad.
pray
now.
for me. Okay, pray for me. I'm
But-
trying. Okay.
I'm gonna sneaker some meat.
I'm just gonna go to my house. She be cooking all the good stuff. I'm like,
I
I'm
send it right to her.
right. I'm gonna go to the house. That's it.
There you
That's what
go.
I'm doing.
There you go.
Okay. Well, everybody, we thank you. Your girl Kiki, thank you.
Thank you, Darshell. Miss
course,
Darshell. We
of
appreciate
course,
it.
Of course. Had a
Guys.
lovely time.
Hand clap for her.
Yes, thank you so much, Miss Darshell. We love
I hope
you.
I wish you guys would have had more questions, but hey, I guess next time go around, bring your
We-
questions.
Yeah,
Maybe we need to put it out a little bit more earlier.
yeah. And we're
whatever.
definitely gonna do the mental health. I really feel that's another.
Oh yeah,
segment we'll
mental
try-
health, substance abuse.
Right.
We'll hit all that.
Yeah,
Absolutely.
so
I'm ready.
we really appreciate y'all. Thank y'all. Please come back Wednesday. We're going to have to find something. We found something really fun.
Don't
we're gonna
tell 'em
be
that.
doing.
Don't say
So
it.
we're not gonna say
We
it,
ain't gonna say
but
it.
y'all just be in
Yeah,
for
be
it.
ready.
Just be ready for it.
We
okay?
having fun. We gonna have fun.
Yes. So thank y'all. We
Thank you,
love y'all.
guys.
God bless. Have a wonderful rest of y'all week. And always remember, be good to each other, love each other, and always protect your peace. And definitely fight against the flesh. Trust me. Don't choose for flesh.
I ain't fighting my
Choose for
flesh.
just because they love you or who they are and good to you. So that's basically it. I ain't fighting flesh. Lord have mercy. Jesus.
That's
Oh,
for y'all.
Lord,
So I'm
God.
just teasing. You're silly. I'm gonna get you something to eat. When you start seeing DoorDash or Uber Eats at your door,
That
just
is
take it.
hilarious.
Just take the
It was so
food.
terrible.
Take the food.
You
You gotta
know,
try
it's